Good morning, friends. David Wright here, and I am your host of the Disruptive Innovators Champions of Digital Business podcast. And this morning, I'm lucky enough to be joined by my friend Ahmed. Ahmed, pleasure to have you on.
The pleasure all is mine, by the way. Thank you, David, for having me. I really appreciate it.
Yeah, absolutely. I had the opportunity to meet Ahmed on one of my last Florida trips, and it was just instant connection, and we had some good conversations just sitting there, drinking a coffee. So I knew that we had a lot of good stories to share with our listeners. So Ahmed, for those of our listeners who might not be familiar, can you just share a little bit about your current role?
Sure. My current role right now, I'm a senior manager of the Digital Innovation and AI Center of Excellency at a major academic healthcare environment in the Southeast, in Miami. I love my job. It's really about bringing that real digital innovation to the operation. And the operation here in the healthcare academic side is more about clinical and HR, all of those people. But it's not only just creating a nice digital innovation tool that it might not be utilized as it should, or it's budget over cost. It's actually as well trying to understand the real pain points and make
Mm,
sure of we solve a real issue within the budget. Because you might actually create a very nice technology, but then you find out it's over budgeted and it's not actually hitting the target that you were aiming.
yeah, absolutely. Makes me think about human-centered design, makes me think about just customer experience. Like, so often you see technologists build these platforms and then try to sell them to the customer versus trying to back in to what they need based on the opportunity or the problem you're looking to solve. So, looking forward to diving into some more, specific examples of that. And we do like to start each episode, Ahmed, with one piece of actionable advice you might look to leave everyone with today?
Yeah, and I love that question because basically it's about everyone trying to very good at one thing, but what gives me that ability and capability, and by the way, it's for me, maybe it's different for you, for different for others, but what gives me that capability that while I was at younger age, I was trying to grow horizontally. Like not only that technical deep part and radiology imaging digital innovation or operational part of it. It's just I was a developer. And okay, what is the other side of implementing that product? Which took a
Right.
different thing. And then what is the other lens of looking at how we're gonna operate the whole workflow into our environment? So try to grow horizontally, learn horizontally, because when you're young, you can absorb more information more than what you think. If you try to
Right.
go vertically, it's good sometime, but I see that you're gonna limit yourself to the just vertical silo that's gonna be in.
Yeah. No, that's great advice. I think it's relevant too. I mean, because obviously as individuals, many people, particularly like a type A personality, wants to strive to reach the pinnacle in whatever that vertical or area is. And that makes sense, right? But, maybe as you're, growing horizontally, uh, you realize you're actually meant to be doing something else. I think the other significant thing that it brings up for me, I remember we were doing an imaging latency assessment for an academic health system in the Northeast, and I brought in a physician, ex CIO, so MD background, but also had been a CIO at a large enterprise health system, and then a radiology and imaging a CIO who used to be at an imaging center chain. And this CIO actually did something similar to what you just described. He got really horizontal with his knowledge of not just technology, but like the inner workings of how everything played together. And he was still very much, a CIO, and his knowledge was rooted there, but he knew a good amount about a bunch of different things horizontally. And what that allowed him to do was kind of run across the stack and have those drop down conversations with all these different groups. And it turned out for this academic health system that the cause of this imaging latency was death by a thousand cuts. Like, it wasn't just one issue. And like, the one of the biggest problems was the people in their individual silos, they were just concerned about their little world, and they weren't really necessarily concerned with the interconnectivity between everything else. And so I think your advice, like, looks to address that.
Oh, and to be honest, I'm not the one who came with it. It's actually when I was at college, our dean, he was the dean of engineering, and he had a medical degree before become an engineer.
Uh,
So he like, and he's the one invented the biomedical engineering back there, back at Egypt, where I come from. So he's the one actually invented that biomedical engineering. He said, "We have engineering that they are talking engineering. We have medical personnel that they understand to a certain extent some of the technology, some of all of that. I need to bring both worlds." So he created the biomedical engineering, and he made it mandate for all the students to study at least 2 years in medicine school.
mm,
So, that was really nice.
and yeah, that is cool. And I like when educators, uh, encourage that kind of well-rounded learning experience. And so let's talk a little bit more, Ahmed, about your journey. So, kind of how you started out and how you got to the point that you're at in your career today. I know that you did you grow up in Egypt originally?
Yes, to a very well educated, highly educated parents that low middle class. So by all means, if I come back to that time, I wouldn't imagine where I am right now, to be honest.
Mm,
But when I was young, always was dreaming about building blocks and see what is the next block that's gonna fit and see where it's gonna take me. So from there, I loved engineering. And I said, I want to be an engineer. And when I went to the engineering school, the biomedical engineering was just a new at this time. And then, okay, this is new thing. And it creates you as an innovator, not as just fixer, which is both right and both good. All right. Now I'm in that phase of fixing stuff. But I wanted that. I needed that. So I studied biomedical engineering, worked at the beginning of my life as a developer. So it's like, okay, now I'm developing stuff as I imagine, creating new things. And then, okay, I'm creating this from behind the desk. I want to see the end product in the implementation cycle and the real time, like how it is, how we going to support it. So I moved a little bit to the operation side. And that open position was not at Egypt. I had to go to Saudi Arabia, our neighbor country, which was really nice. At this time, I was newly married, and now I'm working in the hostel implementing the products that I was developing before, which gave me an edge. Now I see it from two lenses. But then I got my daughter, my first daughter, and I said, okay, as an Egyptian, we live in the middle of three continents, which gives you a huge diversibility. Like you're coming from literally multicultural, plus your own culture. So I wanted that to be for my daughter as well. I needed her to get that holistic culture around her. And by doing that, she will have her own choices, as I did. It let me move back to Egypt, and I got an offer from an American company. Working with them for a couple of years, they said, "Okay, your talent needed here. We need you to moving here." So I said, "Okay, let's work this out." I worked on my H visa. I came here as an H1 worker, worked with them for 12 years on that side. And now I think when I got the university offering me that offer, it's like, this is an offer I cannot turn down. It's like, It's a dream. I work in a big academic environment, and now I will try to put everything I've been learning, like developer, implementation, working with operation, all of that to come together. Um, and I'm doing that right now here in the university. Everything, of everything.
Super cool. I also like, just as an aside, like what you mentioned about, exposing your daughter to, the different cultures. Like that's something that I aspire to do with my daughters. Like every time I've gotten the opportunity to travel, I feel like I become slightly less ignorant. So, um, and I heard a consultant, he had sold his company, a really successful guy. Uh, he had developed a practice of like every year he would take his daughters somewhere else in the world and they would like live there for like a month, basically. Like Africa, Europe, Asia, they would just like, because he could work remotely, especially now he had sold his company. And I mean, I guess this is like not applicable to everyone. Not everybody could pick up and just like post up somewhere for a year. But even if it's just little vacations and stuff, I think educating my children on the different cultures of the world is important to me because like I've learned so much just from learning about healthcare in India or the UK or Sweden or, all the Nordic countries or all different parts of the world. And that's just healthcare, not even like their entire culture, you know?
I totally agree with you, and we resonate in this note because I remember when we talked about this. It's like literally, and even if it's not a vacation, you can just jump and find a good deal to anywhere. And as you said it, like, oh, there's a good deal in this country, and I can go there. Why not? Let's go there and be open. Which means don't go to as a tourist. Go there as literally somebody that needs to see what's this real culture. So try to live in the suburb of that main areas and go around and don't be afraid. And I find out we have different tongues. We have different sometimes mentalities, but we all laugh at the same exact joke. I got it
Mhm.
in Arabic, I translated to English, it works. I translated to French, it works. So literally, like somehow you will find that common ground no matter what, because we are sharing the same 23 threads of the DNA, right?
Mhm. Yeah, yeah. It's, and I think, like, for me, like, laughter is rooted in, like, love as an ethos, right? Like, laughter, love, like and so it's just like that the human experience kind of is translatable across any culture, and I appreciate what you said too about, like, kind of, uh, being open, and I think that's relevant not only for me, not only to, you know, travel and keeping myself open to learning about other cultures, but just in general, how am I showing up in the world and with a posture of not thinking I already know. I've talked about this on the podcast before, but like the humility of remaining a student of the world. Like some of the leaders that I admire the most, like titans of industry, have sold businesses, doctors, like brilliant, brilliant people, still are not fixated on like needing to know or having that position where they're so stuck they can't stay open to the possibility that, oh, maybe like I didn't consider that perspective or I didn't know that, whatever it is. I'm just so clear that there are so many things that I just don't know yet, that I don't even know I don't know. And so I really appreciate that come from is all. I think it's the way to go personally. And I think it actually is really useful in breeding innovation too. So so Ahmed, so you've gone along this journey, you've done a number of different things, and we talked about kind of that horizontal, learning and horizontal, growth. What would you say is one of the most important things that you learned along the way? Or was there a time that you, had a project fail, but ultimately you took a profound lesson, or even like not even a project, but there was a moment in that kind of trajectory where you took a loss, or you took a hit, but then, you had one of those moments where that actually helped you get to the point that you're at right now.
It's all. And it's gonna
Yeah.
happen again, and I'm 100% of it because and this is where I I sit with myself sometimes when this happened and try to evaluate the whole life before me, and I say, okay, I've got many hits, and I sometimes the head like gonna feel like I am even at the rock bottom. It's like this is it, but then take a deep breath, put things together, and you're gonna start growing and getting up. I will not consider it as a big hit, but I will consider it as an example, like something that happened, that a project that I thought that this is it, this is the big thing, and and I learned out of it. Oh man, this is how you're gonna do it. Like digital front door. Like everyone hear that term, now everyone want it, okay? But what we don't understand, Digital Front Door is not an application, like a website. It's everything. It's like how you have your digital footprint. But as a technical person coming from a huge stressful background, look at Digital Front Door. Now it's an application you need to manage, make sure that everything technically in that application, but then you find out, actually, and again, it might be different from an organization to another, from a hostel
Right.
to another. It has to happen according to your perspective and your objective. Okay, so we invested a lot in digital frontal, and we find out that we have duplicate because when we did an assessment, we find out that 90% of our users using that digital front door for one specific reason, accessing their EMR, okay, the record, okay. So we've been putting a lot of efforts into it, a lot of innovation into it, but then it's not the thing that it serves us. Maybe
Right.
because the population around us, maybe because the way it's been published, or whatever the reason is not the right thing for us right now. So
Right.
when Peter Schiff came and said, "We have to shut this bubble down," I'm gonna be honest, I think it was a grain of salt, like, "Oh my gosh, I've been doing all of that," and I'm trying to defend it, like, then I love the way the leadership built for this with me, because they come to me, it's like, "Okay, you're right, but let's prove us wrong. You have all the data. Show it to us," which was a blindsided from me, like, "Oh, you're right. I need to look at the
Mhm.
I'm a technical person. Any product is gonna be like my baby." But then
Right.
sometimes it's not actually my baby. It's just a product. And sometimes it's consuming my time, my efforts for the wrong direction. And I need to redirect myself to be useful for other stuff. And I know I
Right.
will, and I should trust in myself that I will be, because you will have your moments of doubt. And this is another thing. Everyone, surround yourself with people that have trust in you or have trust in you. Because when you have that moment of doubt, they will support you to move on and continue.
Right. No, it's good. Love the comments about the leadership and the support. I think it's and the way they approached it with you, I think is really great, because they weren't trying to make you wrong. You know what I mean? Like it wasn't about like, oh, Ahmed and his team messed up. It was about like, no, we tried something, but now we're looking at the data. It doesn't really serve us, so let's pivot. And like that's what innovation is all about, right? Because I think for so long we lived in a culture where IT couldn't make a mistake because it could mean people's lives, right? We had to remain resilient, we had to remain secure, and the posture was very defensive and urgent and, almost fear based. And then as we innovate, we have to be willing to fail, right? But in order to progress to where we want to go, and we do it, we integrate that feedback and we keep it moving. Um, so so yeah, it's a good lesson. And I mean, it's also a good lesson for me in like when I'm designing these uh type of customer experience related solutions. Is there data that I can get access to, right? Because, like, for example, I just got a partnership with a company that'll now do a for basically, they'll run their software free for a month, and all I can get all the call recordings or all the interactions with the health system, run it through there, and actually categorize the intents and the purpose of each call, and then so as I'm designing these different type of entry points for the digital front door, or, you know, how I'm going to direct patients towards maybe enterprise software that I already have, right? Or, I can think critically about like what that looks like and all of that, right? Like maybe it's as simple as they call in and uh I can send a text message to their phone with a link to the EMR if they haven't, downloaded it yet, or, or they have it downloaded, but then that they click that and takes them right into the app, and that's where they want to be, right?
Exactly. And you
Yeah.
are spot on. You are spot on because this is the most important part. The data. We live in that age that prior ages was all collecting data. And I've been thinking of like all those scientists like spend lots of time and invested lots of money to collect the data, but we see the fruits out of it right now. It was not
Right.
the work. It was actually to come to this moment that whatever you need, wherever you want, you will have it under your fingertip just
Yeah.
by collecting our data.
100%. Um, so I do want to talk a little bit, past that kind of digital front door initiative, kind of some of the stuff, Ahmed, that you guys are working on at your health system. Before I do, I always do like to ask favorite book or literary piece, either that you've read recently or impacted you over time. Your choice.
Yeah, and actually, my favorite book that pivoted the whole mindset of mine is called, and it's different than technology. It's actually in history. It's called "What Is History" by
Mm,
Edward Carr. This book is, when you read it, is the real definition of history. The history is a piece of information, but if you take it from one lens, you're not taking the full picture. So you have to get
mm,
it from multiple lenses, and
interesting.
that literally pivoted me. It's in technology as well. When you look, as we were talking right now, has been the whole conversation about you're talking it from the lens that you spend time and money and effort in one thing, but when you look at it from a different lens, it's different. And it's not like the 6-9 lens. It's like not like the opposite lens only. That book said one example that literally set my road right now. It's like if you are on a four crossroad and there's an accident happened in the middle of the road. Now, the history fact, the fact without anything, there's an accident happened. Okay. Now, if you are behind the both cars, there's two options. Either you were looking at your phone and you hear the bang, so you lift your eye up. So you actually saw the bang after the fact. Okay. Or you're behind the other car and what you've seen is like one point of view from your point of view, and that hits. There are two other lenses that's still there. Gonna identify who's really the fault of it. But without the four lenses, you cannot get a very well defined history fact. The only fact that you
Right.
can get is there is an accident happened in the cross section, and that's it. This is the fact. Beyond that is the
Interesting.
so what
Yeah.
Yeah, I would recommend it for everyone by Edward Carr. It's really nice book.
Yeah, I mean, I don't think we have enough time to talk about like United States history and like what some of our history books say where versus like what actually happened. And um like I'm not overly liberal, but like, you know, look at like the Native Americans in the United States, it was like not a great look. And it actually, I was having this conversation yesterday about, because we're I'm going back to the UK in December, been spending some time in Sweden and their nationalized health systems. And the fact that with these nationalized programs, like in Sweden, one of the reasons I think they work is because the country was always just Sweden, right? Like it's an they've been there for a long time. The community is fairly homogenous. Like even with the immigrant population, it's just like it's been the way it's been for quite a while. And of course, new people come and go, right? Of course. But like compared to the United States, where it's a fairly young nation, right? Like we're talking, you know, I mean, not that old at all, and is also just this hodgepodge of a melting pot of different cultures and people and from all over the world. And honestly, that's what I love about like New York is like the diversity of it and the fact that, you know, in my experience in New York, like while I think we are going through a period of a little bit of like you know, unrest with like the tilted scales of like the 1% versus like everybody else and all that. But I mean, who knows what's going to happen with Mamdani and all that? I don't know. I don't know. I don't get overly political, but still, when New Yorkers come together, either like surrounding the marathon or like other things that are unfortunate, like when we have like 9/11 or anything like that, it's like it's nice to see all these cultures, all these people from different backgrounds, different everything coming together and supporting one another. And it's like kind of almost like an ideal, like what I would hope of society in general, you know?
I support that message as well. I love the way that you put it in context there. So yeah.
Thank you, man. Yeah, sorry for my rant. So anyway, to you guys. So Ahmed, with the time we have left, I'd like to talk a little bit about maybe um, you know, so you've been at this university health system how long now?
I'm working on my fourth year now. Yeah, 4 years.
4th year. So you've been there 4 years. Let's talk a little bit about your vision, you know, for the organization based on the overarching mission of the health system and maybe some of the key initiatives that you guys are working on, or you personally are working on now.
I love that question. Really nice because this is defining what's next. So one of the major things working on that healthcare system is what they are doing, and we are cancer treatment units all over the southern area that we serve, southern up to the northern of Florida. People coming from North Florida just to be getting their cure in there. This is part, and the other part is researches for ophthalmology, and that puts us literally ahead of the world as one of the biggest university for ophthalmology. Between both of those, the most important challenge that I see it even it's for all healthcare is how to have a full secure access by researchers so they can get, as we were talking, informative decisions about what's next in that particular part for cancer,
Hmm.
for ophthalmology, for neurology. Okay. I need the researcher to have full, unrestricted access to those data. Okay. How are we gonna do it? I know this is lots of debates about this is who owns the data. Is it the patient? Is it? But if we're thinking about it, the researchers themselves they need those data for a good reasons. Okay, Now, this is the first part of it, the full accessibility securely for the researchers with the right policies. Now, partial accessibility for transparency for the businesses. I had this conversation with my daughter because she's making a big paper about for her research about insurance companies and healthcare and how politics affected us negatively or positively in that direction. So
Interesting.
exactly. So what we're talking about is like she was we all the time take that to other sides. Like we have to do that because this is how the you challenge their mind. So it's bad. Okay, I said, okay, this is from the perspective of a patient. We all know we all affect. But look at from other side, the devil's advocate. It's like, what about the insurance company who got lots of fraud procedures and all of that? So without accessing the right data, partially, again, this is where it's like, again, researcher full access to the data. Other businesses like insurance, I choose insurance because it's debatable. Partial data for more transparency and more ways to put rail guards to protect the money of the patients and
Mm,
help the patients. This is my vision. This is my whole direction. How are we going to figure this out? And it's going to be a huge work from technical personnel to figure out how to get the right access to the right people. Okay. And from policymaker and process maker, and the policymaker here, I'm not talking about politics. I'm talking about real stakeholders like the business that affecting and affected by the healthcare, the patients themselves. We have in our organization a huge PFAC, which is Patient Foundation Association, that helps the patients to take their own decision and be part of the decision that we're making. We have and finally the researchers who really need the data the most. Imagine this. I'm treating cancer. I'm a doctor treating cancer, and that cancer in the brain, and it's suspicious cancer. But I have only
mm.
a partial access to my patient population data. Imagine if I unlock it with the right AI tool that is saved and rear guarded correctly, that researcher that they can take that data and figure out what's next.
No,
That's
it's
my big
huge.
yeah.
I love that. Um, and what would you say are the biggest challenges, either in general, facing you guys as a health system today, or even specific to accomplishing something like you just mentioned?
Right now, for the time being, with that huge leap in AI, is the same exact thing. How to secure the data so it will not go to the wrong hand
Mm,
is the biggest challenge right now. Security of the data. Are we giving the data to the right AI model that designed correctly that will not require some of the same big tech company, but maybe some other. You've seen what's happened to those technical issues that happened the last 2 months is one big giant and then another big giant that bring everything down. And at this time, you
right.
don't know even what has been. I think this is the biggest challenge, securing those data and give the right access to the right.
Makes sense. Um,
And
no,
again,
Ahmed, this has been. Wait, say that again. Sorry.
this is my own point of view. For sure, I know there are other more challenges than this, but this is what I see is the most challenging for me, at least.
Yeah, no, that makes sense, 100%. And fully acknowledge that. Um, No, so Anna, this has been great. I mean, I've learned a ton already, and I knew this would go this way. So thank you again. Couple last questions I would have for you is, as time progresses, what do you think will be some of the most dramatic changes we see in the healthcare industry as a whole? You know, or like with acknowledgement that you don't have a crystal ball, where do you see the health industry going in the future? What do you think will be some of the biggest changes as time passes?
From what I'm seeing right now, two major changes gonna come. Transparency gonna get better and better because now people have access to the data and they have AI models. That's gonna happen no matter what. The second big thing that I'm seeing as well as happening, cure of major diseases is coming soon because if the researchers utilize the technology correctly and literally partner with the technical teams, they will get to that point that they will focus only on how many patients they can really treat and instead how
Mm,
to figure out what is the treatment. And this is my
yeah,
like
I love that. Um, Last question for you, Ahmed, is if you could go back 5, 10, 15 years of time, what advice would you give your younger self?
I said it in the middle and I'm gonna say it again because I had that doubt. Trust yourself, you will move.
Mm,
And here I am.
love that. Ahmed, thank you so much for taking the time today.
Thank you so much for having me and thank you for making it easy.
Oh, come on. And to our listeners, thank you for tuning in, and we will catch you all next week.